Hello there. In this video, we're going to be looking at the 12 professions covered by the OET and, importantly, why you need to know them. Because you're probably wondering, okay, I'm a doctor, I'm a nurse, I'm a pharmacist, I'm a vet, whatever you happen to be. You're thinking, why do I need to know the other 11 professions offered by the OET? Well, I'm going to tell you why it's so important. I'm going to explain to you what they are, what they do, and what you might hear in the OET listening, and give you some ideas of the types of scenario that you might come across. Welcome back for those of you who are joining me again. Hello to our newcomers. My name's Sona. I'm your online OET tutor with Bose Learning, and I'm a premium preparation provider of the OET. Thank you for upgrading your OET with us. And a quick reminder, why not subscribe to us so you'll never miss one of our videos when they come out. Okay, so let's get on with this. Why do I need to know these 12 professions? That's probably what you're saying. Well, the reason is that the listening part A of the OET subtest may feature any one of these 12 professions. And you may also encounter one in the writing. For example, you may need to do a referral to this person. So, in order to get ready and be prepared for any of them to come up, it's really important you know what they are so you can score well, so that you're really familiar with what each of them do. So, what are they then? What are these 12 professions? Some you'll know really well, I'm sure. Some you may not be so familiar with. So, we're going to go through all of them. And as I say, we're going to go through some possible scenarios that you might encounter in the listening part of your subtests. So, what do these professions do, and what could you hear about them? We're going to go in alphabetical order. The first one is dentistry, and my definitions come from healthcareers.nhs, so they are all up to date definitions of what these professions do. So, dentistry, dentists, I'm sure you're all very familiar with. They are the front line of good oral health. As I'm reading, also just listen out to the way I pronounce things because that's going to help you with your own pronunciation. So dentists and dentistry, and they work with communities to prevent and treat dental oral disease, correct dental irregularities, and treat dental or facial injuries. Just note here, this I is silent in English, facial injuries. Okay, so in the listening test, you might hear a general dental practitioner taking the history of a patient, or you might hear a consultant, so a specialist, asking a patient to explain what previous treatment he or she has had as a result of a trauma or possibly a disease. So you might get an everyday kind of encounter or something more specialist. Moving on to the second profession, and that is in the region, that is in the field of dietetics, and it covers dietitians who translate the science of nutrition into everyday information about food, and they generally have an advisory role and they help people with the choices they make. So, in the listening part, you might hear a specialist, you might hear a haematology dietitian, for example, working with a patient diagnosed with blood cancer and asking them about the weight loss they've experienced. Because obviously, a dietitian will work with the patient to try and redress that balance, to try and stop that weight loss. So, in part A, remember, you'll always get more from the patient talking. So you could also get something like a review happening where the dietitian asks the pre-diabetic patient about how they're going with the program. Is it working for them? What is, what isn't? You might also get one of these in the writing. So if you are a doctor, you might get a referral to a dietitian coming up. So just be ready, be familiar with this kind of profession, this field. Okay, moving on to nursing. I think we all know what a nurse does. And in the listening part, you might hear a nurse asking a patient about their past medical history for a review. Patients often come into nurses to have their annual review. Or you could get a patient telling the nurse about a rash that he or she has been experiencing. So again, the nurse will be taking history. And then we move on to profession number 4, which is in the field of medicine. Here, you're likely to hear a specialist or a GP dealing with a specialist condition. For example, you might hear a dermatologist asking a patient to describe their skin condition, or you could hear something like a GP talking to a patient with a suspected bladder infection, so taking the history of the patient. Number 5 is an occupational therapy field, and this often causes confusion. I've had so many of my own candidates who really have no clue what an occupational therapist does. So let me just explain that an occupational therapist deals with helping people with any kind of difficulties they have in their day-to-day activities. It doesn't just have to be about a job. It could be someone who has a disability, an illness, or a trauma, or is aging, and it could be dealing with their workplace, or it could be dealing with their home. For example, helping them get back to doing the activities they love, such as gardening. So it's not just about the occupation of someone. In the listening, you might hear an OT, an occupational therapist, asking an elderly person what kind of activities they're struggling with. They've just had surgery and they want to know what they're finding difficult. Or you might hear an occupational therapist talking about someone's job, asking an engineer about what they're finding difficult in the workplace after surgery. Again, this is something that may come up in the writing as a referral, so just get familiar with this profession again. Number 6 in the list is optometry. And optometrists, and that's the pronunciation, optometrists, are at the front line of eye care, and they carry out examinations to improve the health of the nation. In the listening, you might hear an optometrist asking a patient about an eye infection to describe the symptoms, or it might be a review again. A patient might have come back in following cataract surgery, and the optometrist, is finding out how things are now. Okay, and we're halfway through our list of professions. Let me just take the opportunity now to say, why not listen to one of my lessons on OET Listening Part A to help you, but can't do that afterwards. Come back to that later. So I just want to go through the following 6 professions just so that you are completely on top of this all. Number 7 is pharmacy. Again, we all know what pharmacists do, and in the listening, you might hear a pharmacist asking a patient if they're taking any other medication, if there are any indications, for example. Or it might be a pharmacist asking a parent or a carer to describe the symptoms that their child has been experiencing. So it might not be a direct consultation, it might be in reference to a child. Then, number 8 comes physiotherapy. And a physiotherapist helps people improve their mobility and to regain independence after an injury or operation, or as a result of aging or disability. In the listening, you might hear a physiotherapist asking a patient to go through the exercises he or she has been doing in their own words, so to explain to them what's been happening. Or you might get a physiotherapist asking a new patient to explain his or her lifestyle so they can get an idea of their levels of activity. Now, number 9 again is something you might not be so familiar with, and that's the field of podiatry. And a podiatrist treats and cares for people whose feet and legs have been affected by injury or illness. In the listening, you could, for example, get a podiatrist asking a patient to experience the knee pain he or she's been experiencing. This is something that happened to me actually. I'm fairly young and healthy, but I've had knee pain. So I was referred to a podiatrist who asked me about what I was experiencing and actually gave me some insoles for my shoes to help with the pain. Or you could hear a specialist, such as a diabetes podiatrist, asking a patient about a wound and how that's been treated. So, again, it could be an everyday kind of history taking, or it could be something more specialist. Number 10 then is the field of radiography, and radiologists are really innovative. It's one of the frontline healthcare professions that's very much in demand in the NHS, and they understand the root causes of an illness and help with diagnosis. So, in the listening, you might hear a radiographer talking to an emergency patient, asking him or her about his pacemaker, for example, or it might be something like a radiographer dealing with a patient who has a complaint by asking them what their concerns are, what's the issue. Number 11, so we're nearly done, just two more. Number 11 is a speech pathologist, and this is the field of speech and language. And therapists here provide treatment, support, and care for children and adults who have difficulties communicating, eating, drinking, and swallowing as well. So there might be any number of reasons why this is happening, including physical or psychological, and a speech pathologist will help these patients live or get over these difficulties. So you might hear, for example, a speech pathologist asking a stroke patient about the difficulties they have had since they've had the stroke, or it could be something like a speech pathologist talking to a parent of a child who's been stammering, trying to find out what's causing this stammer or when it occurs, for example. And the last one is veterinary science. I would love it if they had a vet talking to a dog in the listening, but of course they wouldn't do that. They would have something like a vet asking an owner about how their puppy has sustained an injury. Maybe the puppy's been bitten by a bigger dog, finding out how that's happened. Or it might be a vet asking an owner about the progress their dog, their cat, their rabbit has experienced after surgery. Maybe asking about progress, activity, diet, that kind of thing. So, again, it's taking history and it's maybe reviewing a situation. And in listening part A, it will always be the patient or the carer doing most of the talking, but you will hear a little bit from the clinician and you will, of course, get the background. So, get familiar with each of these 12 professions because that will make it so much easier for you to answer well. If you do have any questions or comments, feel free to get in touch. Put a little note in the comments box below and I'll try and get back to you. For more information about my on-demand courses, which you can study in your own time, take a look at the info box below. I've popped in some discount codes for you. And if you do like this video, I'd be so happy if you can help my channel grow. Just send it to a friend or a colleague, subscribe to us and like this video. That would be lovely. Thank you very, very much for watching. Why not watch one of my other videos, for example, Listening Part A, right now so you can get on with your revision. Take care and see you next time. Bye.